Hello everyone and welcome to week number 2 or module number 2. This week our focus is on continuous patient care and family medicine. Now with that we are looking at 5 different chapters, but these 5 chapters are all things that you've already looked at, reviewed, and discussed in previous clinical courses. Those 5 chapters are Chapter 35, Chapter 36, pages 795 to 803, Chapter 42, pages 979 to 984, Chapter 48, pages 1141 and 11 through 1143, and finally Chapter 57, pages 1347 and 1348. So let's go ahead and jump on in and get talking about these. We're going to start with Chapter 35, which is looking at vital signs. Now, hopefully by this time, you guys are all very well endowed into doing vital signs. Hopefully you have a good understanding of what vital signs are and know that those are the main responsibility of medical assistants. Because what we're able to do with vital signs is give the provider a quick snapshot of how the patient's body is functioning. And with all vital signs, there are 6 main ones that we are responsible for. Those are height, weight, temperature, pulse, respirations, and blood pressure. Now, because we're also dealing and discussing with family medicine, it's a good idea to understand what that really means and what is really your kind of role and responsibility in family practice. Family practice physicians treat the entire family regardless of age and gender. In some cases, they will refer to patients with specific conditions to specialists, but really they can see anything from birth to death. This also means that this type of doctor will look at the whole patient, making the use of vital signs extremely important. Now, again, at this point in your course, my hope is that you have a good idea of how to obtain and measure and collect all of these vital signs. And hopefully you won't have to have too much of a review on that. Next, we're going to talk about Chapter 36, which deals with the assisting with medical and physical examinations. So this is also one of the key responsibilities of medical assistants. And with this, your role is to really prep the exam room, interview the patient, document all of the information in the medical record. So let's go ahead and take a closer look at each of those. So in preparing the medical exam room, the medical assistant will dispose of any used patient gowns or drapes that were used in the previous examination. You will clean the exam table with a proper disinfectant and replace the table paper with new paper. You will also dispose of any equipment used during the previous exam, but if it is reusable, you need to make sure that that is cleaned and disinfected, or at least into the appropriate area where it can be cleaned and disinfected. All surfaces in the exam room must be disinfected with the appropriate cleaner, whether that be a Cavi wipe, a Clorox wipe, or a bleach water solution. And then you will close any lids on biohazard material containers, or if they're full, replace them with new ones. Then you also interview your patients. And with interviewing patients, it's important that we take a complete history to help the provider. A complete history is broken down into 6 categories. We have the chief complaint, which is the reason for the patient's visit, the present illness, which contains details and descriptions about the symptoms, such as the onset, the duration, and the intensity of each symptom. The past medical history is the part of the history that includes all diseases and medical problems that the patient has experienced in the past. Family medical history is a record of health problems that the patient's blood relations have, such as mothers, fathers, brothers and sisters, maternal and paternal grandparents, aunts and uncles if only related by birth, not by marriage. The social history includes lifestyle patterns that could affect the patient's health status, such as smoking, drinking, the use of recreational drugs, what their occupation is and what their marital status is, what their sexual preference is, their diet and exercise patterns, as well as sleep habits. And the final piece is a review of systems. Now, this piece is generally performed by the physician, and they will use different methods to examine and inspect the patient. There are 6 methods that providers use during this part of the examination. Those are inspection, palpation, percussion, osculation, mensuration, and manipulation. So this chapter also goes on to focus on assisting during minor surgeries, and in some family practices, you will have to look at and talk about and help with surgical procedures. So that's all going to deal with chapter 42. So with that, you will be responsible for potentially cleaning a wound, suturing wounds. Typically, that's not something you will do. You might just be responsible for removing them. You'll also get to apply sterile dressings and bandaging up wounds. Now, with cleaning a wound, it's really important that you make sure that a sterile dressing can be applied, and you always want to use a sterile dressing. Warm water or soap should be used to remove any surface dirt from the wound area. You also want to make sure that at least 1 inch beyond the edge of the dressing is applied. So you don't want to put it just to the edge of a dressing. You want to go all the way about 1 inch past it. When you're suturing, this is where you will take a thread that is used to sew body tissue together. Sutures are made of non-absorbable materials such as silk, cotton, linen, wire, nylon, or even polyester fibers. And what you want to do is pull the skin together and seal it up so that way that it can heal without receiving any sort of infection. But along with doing minor procedures and helping during that procedure or cleaning up from that procedure, you might be involved in a minor surgical procedure that happens in an office. Things such as electrosurgery, laser surgery, colposcopies. You might have some removal of foreign bodies or growths, incision and drainage, any cryosurgeries. I know that working in family practice myself, those are something I do a whole lot. Next, we do have chapter 48, which is dealing with hematology. So these few pages are really required for reading because it focuses on blood tests that are typically ordered within your family practice area. Those could be lipid panels, liver panels, a CBC, which hopefully at this point you know is a complete blood count, and that is actually the most common and most performed hematology test. You could do coagulation studies that look at the patient's blood clotting factors. So in your book, Table 48-2 and 48-3 are really great guides for you guys because what it does is it will explain the common lab tests, their normal values, and will show you all of the components and the common blood chemistry testing, as well as what is all in those panels. So definitely something that I recommend you looking at. I've put just Table 48-2 up here, but really you should be looking at both of those yourself. And the final chapter is chapter 57, which is looking at nutrition. So nutrition includes all the processes involved in using food for growth, repair, and maintenance. Nutrition is a process including ingestion, digestion, absorption, and metabolism. Now, there is what we call a standard American diet, or a SAD, and what that is the standard American diet really contains too much fat, too many calories, too much cholesterol, too much salt, not enough fiber, and an insufficient amount of complex carbohydrates. So what your job will really be to do as a medical assistant with this is to really explain that the best kind of diet a person can have is a well-balanced diet, and helping them set up eating plans with the correct proportions of major nutrients. So you need to understand that during this, your role will be to work with those nutritional professionals. Could be family practice providers, or it could be a nutritionist themselves. And you'll also help them with providing patient education and materials on the nutrition plan set forth, assisting in researching and creating patient education plans and programs, completing referrals and pre-authorization with the health insurance plans. And as always, the major role that you have will be to support and encourage your patient as they embark on some dietary changes, which are never easy. Help them to understand the importance of following through with not only the diet, but also follow-up appointments, because that's how we make sure that things are actually properly working. All right, everybody, so that is the quick overview of the 5 chapters that you had this week. So that's, again, chapter 35, 36, 42, 48, and 57. The last thing I want to talk about this week is your homework assignments. So this week, you actually do have a discussion post. Your initial discussion post will be due on Tuesday, October 10th by midnight. And you'll have to reply to at least one classmate no later than Saturday, October 14th. For your discussion post, what you're doing is you're looking at titrating medication. So in this discussion board, you have a patient with a really horrible case of poison ivy, and the provider has ordered prednisone. And they give you the prednisone schedule that the provider has ordered. What you need to do is discuss why the provider would write the prescription in the way that he did, and what the term is for this type of dosing. Now, the provider also gives you an order to titrate oxygen, or O2, to maintain a saturation of greater than or equal to 93%. What you then need to do is explain what titrating means and really what the provider is asking you to do in this case. Please remember that discussion boards are to be written in APA format. You do not have to have a title page, but you do need to have references and the use of in-text citations. If you don't know how to write or formulate things into an APA format, please reach out to me so I can kind of help you and guide you and give you some tools and tricks to help with that. Additionally, you also have a case study this week, which is looking at community measures and healthcare quality. So what you have is you will be looking at the measurements, community measurements for the state of Minnesota. Whether you live in that state or not, you're going to be using that website, okay? And with that, you're going to look through that website, you're going to research it, you're going to do some in-depth looking, and what you need to do is there are 5 questions in your homework assignment that you need to answer. Now, just because these 5 questions are written in a question format does not mean that I want question and answer. What you need to do is take those and write them into an APA formatted paper with a title page, a reference page, in-text citations being used within your work, as well as writing in proper paragraph formation. Again, if you have any questions with how to write in APA format, please reach out to me as soon as possible so that I can help you with that. All right, guys, that is all that I have for Module 2. Please make sure that you are reading your pages for your chapters. There aren't many of them, so I really highly encourage that. If you have any questions, make sure that you reach out to me as soon as possible, and have an awesome week too. Bye, everybody.